This is a case where there's a pretty strong Bell's phenomena as well as a mid-dilate pupil. So I just put in a lamellus incision there, pull down the globe with my Sinskey hook and go ahead and fashion my 2.8 millimeter Phaco incision. Now leaving the keratome there, I then go ahead and place my side port incision as well. And although the AC has shallowed a bit, I do put in some air and then stain the capsule with trypan blue. I'm here washing off the trypan blue with some intracameral xylocaine, after which I express out the air bubble and the trypan blue with HPMC. I then decide to go ahead and put in another side port. You can see that this Bell's is extremely strong, and I don't think probably maybe the patient is feeling some pain, but pretty cooperative anyway. I then go ahead and make my capsular axis using the pupillary margin as a guide. I somehow decide, because of the density of this nucleus, which is pretty easy to chop, I decide not to use any expansion device. The next step, of course, is the hydrodissection. I can see the forward movement of that nucleus, so I know it's well, the hydrodissection has gone off well. I do, however, push in some more waves just to make sure, and then pressurize the chamber with BSS and later with 2% HPMC, and now I'm checking the rotation of this nucleus. I really need, because the pupil isn't too great, I need this pupil, the nucleus to be well separated and mobile, and that's it. That's the movement I was actually looking for. So I take a sharp chopper in my left hand, and I'm going to take my Phaco probe in the right, and I'm planning to do the direct vertical chop. Now the chops better be good, otherwise it is going to be a little difficult, because not only is the pupil small, because the pupil is small, the rexus is also not that big either. So, and that's a good chop. So once you get the first chop, invariably the rest of the surgery goes off well. Although I do have to watch out for this pupil. Just aiming to make 4 pieces before I actually start eating away into them. There comes out that central disc. Makes the view even better. It's important for you not to inadvertently engage that pupil. I decide to exchange my sharp chopper for a Sinskey hook. And all is going on well. rather than coming out with my Phaco probe and rotating this nucleus, I just try to push this nucleus down for beta axis. I'm a little worried that if I keep coming out with my Phaco probe, the pupil will shut down further. And that's well done. That's out. I need to get this small bit out. Yep. And that's done. Just cleaning up that incision. It's at this time I put in some intraocular adrenaline. And the pupil is dilated okay. You can see that there's hardly any cortex, but I really need to check that. I do check and there's nothing much. So here I decided, and here this was probably an error. I decided to hydroimplant this hydrophilic single piece IOL. Probably I should have gone a little deeper. But you can see it hasn't gone into the bag. But since these lenses are so flexible, it's no big deal actually to get it into the bag. And I thought I got it into the bag and realized, no, hold on. Am I in the bag or in the sulcus? And it looks like I'm in the sulcus, yeah. So again, I have to repeat this step, and this looks a bit scary, but as I said, these lenses are pretty flexible. And there I've got it into the bag finally. And with that, I put in my intraocular antibiotic, just check the wounds, and conclude the surgery. Thank you so much for watching, and that's the post-op on day 1. Looks good. Thank you again for watching this video.